Hello and welcome. Thanks so much for joining my virtual COVID town hall this morning. I'm joined today by Dr. David Goodfriend, who's the director of the Loudoun Health District. We're here to give an update on the virus and vaccination efforts here in Virginia 10. I've been hearing a lot from constituents with questions about Omicron, especially if and when they should get boosters and any new public health guidance. Today, we'll be able to answer those questions and more. Leave a comment in the chat if you have something you'd like to ask me and Dr. Goodfriend. We've made remarkable progress in our fight against COVID. We've made vaccines widely available to keep ourselves and others safe from serious illness. We've gotten our kids back to school full-time in their classrooms and supported our families and small businesses as we bounce back from the financial fallout of the pandemic. Now kids 5+ are eligible for vaccines, a huge relief for parents. We'll talk about why that helps in our fight against COVID, and it can answer questions about kids and vaccines. We're in a much better place in the fight against this new COVID variant than we were a year ago. 75% of Virginians have received at least one dose of the vaccine, which public health officials say is our best tool to protect against Omicron right now. Thanks to our efforts in Congress, COVID testing is free and easily accessible at public health centers, pharmacies, and even at some local libraries. Our community has shown incredible resilience and care as we've battled COVID over the last year and a half. Together, we'll get through this next stage strong. The best way to do that is staying informed, which is why I'm looking forward to today's discussion. Again, if you have any questions, please leave them in the comments and we'll get to as many as we can. I'd like to toss it now to Dr. Goodfriend for a brief overview of Omicron and where we are in battling this virus here in Virginia 10 and beyond. Dr. Goodfriend, thank you so much for joining us today.
Sure, thank you. And thank you for asking me back. And I think the timing of this is perfect. As you had said, this is the time when the COVID virus wants to spread. It's a cold weather virus. It was around this time last year that we started entering our winter surge. And just like clockwork, we're in it again. So since Thanksgiving holidays, we really have seen a very significant increase in the number of cases, not just in Loudoun and in Northern Virginia, but throughout Virginia, where the whole state is now in a high level of disease transmission. Also, as you mentioned, there are a lot of positive things going into this winter surge. Vaccine being by far the number one positive change compared to last year. It really is a game changer. It has allowed me to spend time with my family over Thanksgiving, and for many folks to be able to spend time with family over Thanksgiving, over Christmas, and throughout the winter. But we know that vaccine's not perfect, and particularly with Delta variant and with Omicron, you can still get infected even if you're vaccinated, although it's much less likely, and you can still pass it on to others. The other things that we have going into this winter is we don't have the same lockdowns that we had last year. Our schools are open, which is a tremendous benefit to our kids, but it is an opportunity for the flu to spread. So where we didn't have a flu season last year, very likely we're going to be dealing with the flu at the same time we're dealing with the COVID surge this year. So the more folks are protected, both with flu shots and COVID shots, and follow those same mitigation steps of wearing masks indoors, keeping distance from others, staying home when you're sick, those are all critical steps to getting through this winter and getting through safely.
So Dr. Goodfriend, it's interesting that you mentioned that we're going through a bit of a surge right now. Because we keep an eye on the Loudoun County schools, of COVID numbers because we have a child in the schools, and there's definitely been a surge since Thanksgiving, and so that is of course concerning. But I think that's because of all the travel and everything with people over the holiday. So hopefully that'll come back down as people stay put, hopefully for the rest of December until we get into the holiday season at Christmas. And then,
and also each day, the 5 to 11-year-olds more and more are getting vaccinated. And so that really is one of the best steps we can take right now to keep the schools open this winter, is for everyone who's eligible to get vaccinated to do so.
Yeah, great. So we have some questions that were pre-submitted before we get to questions from the chat. And so Justin, do you have any questions that you want to read out to us and to Dr. Goodfriend?
Absolutely. We'll start here with a question from David from Chantilly, who asks, what is the difference between the Omicron and Delta virus? Can an asymptomatic person infected with Omicron spread the virus, or do they have to start showing symptoms before they can spread the virus?
Yeah. We're still learning about Omicron. One of the real challenges with the COVID virus is that it changes or mutates very easily. And the more people who get infected, the more opportunities it has to change. And sometimes those changes come to a form where it doesn't want to spread and those go away. And sometimes, like Delta and Omicron, it turns to a form that's a little easier to spread. So right now, what we know about Omicron is it's probably at least as easy to spread as Delta. It may not have that same level of protection against vaccine as Delta and the other variants, although it seems to be that the vaccine is still pretty effective against Omicron. And in general, it's a mild infection. So some of those are good news. In general, though, what it means is those same mitigation strategies that people have been taking to keep safe from Delta, from Alpha, from the original virus should work against Omicron. We just need to really take all of those mitigation strategies in hand because they all work together. The vaccine is not 100% effective. Wearing masks is not 100% effective. Getting it, even if you get a test every week, is not going to be 100% effective. But all of those together really decrease the likelihood of spreading the virus. And as the question said, real challenges for COVID, a lot of folks are infectious and can spread it, but don't even know they're sick. If people knew they were sick, they'd stay home. But because COVID, many people, particularly our kids, are infected and infectious, but don't know there's anything wrong. They're in school, they're playing with friends, they're going to the supermarket, and that just increases the likelihood of spreading it if you're not taking those other mitigation steps all the time.
So, Dr. Goodfriend, following up on that, we know that Omicron could be at least as transmissible as Delta and maybe even more so. Do we have any statistics so far, or is it too soon to tell whether it's more severe generally? You said something about it generally being mild. Yeah. Is that the case? Is that the case in people who have received vaccines who have the breakthrough infections, as well as people who are unvaccinated who get it?
So, the one challenge is right now we're mostly looking at data from other countries. And historically, while we may find the same things in the United States, sometimes the disease spreads a bit differently here. So it's hard to say for sure. But we definitely know that if someone gets infected who's been vaccinated, they're much less likely to have a severe infection, whether it's Omicron, Delta, or any other variant of the virus. So that's, I think, one of the best news for this winter. Whereas last year, so many people were hospitalized and died as a result of COVID. Given our high vaccination rates in Northern Virginia, and hopefully getting higher every day, while we may get a lot of cases of COVID, hopefully we're not going to see anywhere near the number of hospitalizations and deaths we saw last year.
Thank you. And just following up on that a little bit, there was an article in this morning's paper about the fact that Omicron is probably going to take over as the fastest growing part of the infections in several, I guess, European countries. So, are we seeing that here in the U.S., or do we not have the same genomic testing that they do in Europe to be able to say with any precision whether that's happening, whether it's going to overtake or whether it's growing at such a rate that it may overtake Delta?
Likely we won't know until after the new year because we're just starting to see it showing up right now. And so it's going to take a while after it shows up to get that sense of, as Delta and Omicron compete for that next body to infect, how much easier it will be for Omicron to win. So I think it's probably going to be a good 2 or 3 weeks for us to get a good sense of how quickly Omicron will take over the proportion of cases. Delta did that very quickly over the summer when it came around and really was responsible for the summer surge. From what we're hearing so far, that difference between Delta and Omicron is not nearly as big as the difference between Delta and Alpha, which was the first variant we had, where Delta was so much more infectious. But either way, this is going to be the first time we're dealing with Delta or Omicron in the schools, a much more transmissible form of the virus in our school setting. And for all of us, the goal is how do we keep our schools open? How do we keep our kids in school?
Right.
And that's where a lot of our focus is now, is how do we get as many of those 5 and over vaccinated so they're protected? How do we maintain masks in schools, distancing, and all those other steps that have been so successful so far this year in our public school system and allowing the schools to stay open?
Yeah, well, we all want that. That's for sure. Speaking as a parent, for sure. Great. Okay, Justin, do you have any other questions from that are either pre-submitted or from the chat?
Yes, that actually segues well into our next question, two of which we got from students, Krish and Jack, both from Ashburn, who say they're students, freshman year of high school, and they want to be assured, that schools won't be closing again, and what actions we can take to make sure that schools aren't closed with either Omicron or new COVID variants.
Yeah, and those mitigation.
If I may, Dr. Goodfriend, I just want to say we were in such a better place than we were last year when it came to schools, and that's probably why schools are now open and we're able to keep them open, because we know what works and what doesn't, and also, kids 5 and over can be vaccinated, so that's huge. That's going to make a big difference in terms of kids' safety in schools and everything. So I don't think anybody wants to close schools again. I know that you guys don't want to learn on little boxes and everything like that virtually, and so, hopefully we'll be able to keep up with the mitigation strategies that have been so successful in the past and keep the schools open. That's what everybody wants. Dr. Goodfriend.
And that's really our focus. We've been spending the bulk of our energy of seeing how do we keep the schools open. Mm-hmm. And so we've been making as many appointments as parents can handle to get 5 to 11-year-old kids in so they can get fully vaccinated. We want all kids fully vaccinated. In addition to that, what's been very helpful for our public schools in Virginia is the health commissioner's requirement for indoor mask wearing. That may go away in January as a state mandate, but will be very important to keep in place if we want our kids to remain in school. So it is one thing that local school boards, private schools should really consider should the requirement go away. Because that is one of the things, and you had mentioned, Representative Wexton, that we're seeing increased cases in the school, but we're not seeing significant outbreaks in our public schools.
Right.
And that real distinction is all those other mitigation steps that our schools are taking with mask wearing, distancing, sending kids for testing, keeping kids home when they're sick, that are going to be so critical. And as I mentioned, the schools are also going to be dealing with the flu, which typically comes on strong in January. And even before COVID, we would have outbreaks of the flu in the schools. Those same mitigation steps for COVID are really going to be critical for flu as well.
Well, when I got my booster, I got my flu shot at the same time. So that was very convenient. I was glad to see that we could do that. So I hope.
And you bring up an important point. There's no separation you need to have between the COVID shot and any other vaccine. You can get your COVID booster and flu shot at the same time, any other required vaccinations. Just add on the COVID shot right at that visit.
That's good. Well, and I'm very pleased to say that my 16-year-old got a booster appointment for today. So I'm glad that Loudoun is moving forward on those as well. So that's good news. Great. Austin, do we have any more questions for us?
Yes. Next one here comes from Charan from Ashburn, who asked, after recovering from COVID, can a person still spread it to others? If so, for how long? So
typically, it's been found that if someone's been infected with COVID, assuming that their symptoms resolve, that they're no longer going to be infectious after 10 days from when they first found out that they were sick. Now, some people take a little longer to fight that infection off, so they still may be feeling sick. But after that 10-day isolation period, we don't expect folks to pose a risk to others. And that's why we've had that 10-day isolation that's been in place for the last 2 years. In general, in addition to that, those folks are less likely to get reinfected within 90 days after having an infection. They're really re-looking at that data because Omicron does not seem to be an infection does not seem to be as protective against the Omicron variant. So that's why it's really important, even if you've been infected with COVID, to get vaccinated. The natural immunity you get from having had the infection is not nearly as protective as what the vaccine can give you.
That's good. That's good advice. I wasn't aware of that. And so the natural antibodies that your body produces don't last beyond 90 days, or that the Omicron variant is probably resistant to them anyway, is what you're saying, right?
But it may be more resistant. Yeah, because the challenge is as the virus mutates, it looks different to the body than the other variants. The way the antibodies, the way the vaccine works is they attack more core parts of the virus than what your natural antibodies might do. So
Okay.
Omicron could fool your body's antibodies, but it's less likely to fool the antibodies created by the vaccine.
I see, because it's kind of a broader spectrum of coverage than just whatever the specific variant or the specific strain of COVID that you could happen to catch.
Correct.
Got it. Okay, good. Justin, do you have another question for us?
We do. We have a couple questions here about vaccines and boosters. First one comes from Signe from Herndon, who asks, are booster shots recommended for those under 60? I've seen some reports that state younger folks are not losing their protection while older folks are. I only want to get a booster if there's a pretty good chance it will help.
Yeah, and as Representative Wexton pointed out, just starting this week, the CDC has recommended boosters for everybody age 16 and over. So one of the things we knew going into this is that younger kids are much less likely to get severe disease. They still may get severe disease. We just, over the Thanksgiving holidays, unfortunately, had a child who died from COVID. So it does happen. But the much greater concern with children is that they are the ones that are spreading the disease to others. So what we found recently is before the vaccine was approved for 5 to 11-year-olds, they were by far the major spreaders in Loudoun County. And they would bring it home to family members who may be vaccinated, but because they have such ongoing contact with those family members, even the vaccinated family members may get infected. So it continues to be a concern of not, even if for your own sake, it may not put you in the hospital, it may not kill you, even though it might possibly do that. You can pass it on to others who may have much more of a severe reaction. And in addition to that, if it's in a school setting, may result in other kids being missing school, or for a whole class being sent home if the outbreak is large enough.
Thank you, Dr. Goodfriend. Justin, do you have more questions?
Yes, our next question here comes from Jamil from Loudoun, who asks, are the current COVID-19 vaccines and booster shots effective towards the new Omicron variant? If so, how much? From a concerned frontline worker.
So everything we know is that vaccines are still very effective against Omicron. What's been very fortunate for the COVID pandemic is that the vaccines are just so very effective against severe illness. The flu vaccine, which we've had every year and we take every year for a generation, may only be 60% effective, whereas the COVID vaccines get into the 90% effective or greater. It may be a little less with Omicron, but that's why they're recommending everyone get their vaccinated, and as soon as they're eligible for a booster shot, to get that booster shot, because that makes it even more effective against Omicron.
That's great. And thank you, Jamil, for being a frontline worker. I know that it's been really hard for frontline workers over the past 20 months. So thank you for being out there and doing your job so the rest of us can continue doing our jobs.
And next question we have here actually comes from our live chat. We have a question that asks, can you take any vaccine variants, or do we expect that there will be new vaccines developed specifically for different variants of COVID?
One of the benefits of the new way that they've created most of the vaccines that are out there is that they can put in slight changes to that vaccine and have it out probably in 2 or 3 months' time. So what we've been told is, as new variants come along, and easily there will be new variants along, that if it turns out that any of those variants are not covered by the existing vaccines, they can get that vaccine changed. But that said, so far, all the variants we've seen are covered to either a great degree or a pretty good degree by the existing virus. But that is the concern that we have, that so much advance has been made because of the vaccine and because people in Northern Virginia have gotten vaccinated, that we don't want to go back to a point where the vaccine is not providing that coverage, particularly for our seniors and our medically fragile folks. And the best way to prevent that from happening is to keep our case numbers down as low as possible. Because every time there's a transmission of the virus, that's that one more opportunity for that virus to mutate to a form that may not get covered by vaccine.
And I think some of it also is a policy decision on the part of the vaccine makers, because, are they gonna change their whole production and everything and slow that down to deal with this one variant in one place, or are they going to try to get as many people vaccinated as they can all over the world in order to stop the variants from happening at the outset? So some of it's a policy decision, and some of it's also just a decision based on the medical efficacy of one over the other. So I think there's a lot of balancing of interests going on with it all. Excellent question. Justin, do we have any more questions either from the chat or?
The next one here comes from Camilla from Leesburg, who asked, for those of us who have recently returned to the US and received 2 Sinovac vaccines and a Pfizer booster in September, do we need to get additional COVID vaccines?
In general, the answer is no, that if you are fully vaccinated in another country through a vaccine that's approved in that country, and then come to the United States, get an FDA approved booster shot at that appropriate time, which is typically 6 months after you completed the last series, then you're considered fully vaccinated.
So that's a really good question. That actually is a good segue to some questions that I had about mixing and matching vaccines. And I don't know, is Sinovac an mRNA vaccine, or is it a different kind of vaccine? Does it have a different?
And I'm not familiar with it. I think it's common in Asia,
Mm-hmm.
but I'm not familiar with it because it's not approved in the United States.
Got it. And so, for example, we've heard about studies where people get the J&J and then Moderna and those kinds of things. Is there any reason that you can't mix and match boosters and your original vaccine? So if you get, for example, Pfizer for your original vaccine, can you get a Moderna booster, or should you get a J&J booster? I mean, does it really matter, or do they all have different efficacies?
Yeah. So initially, the thought process was you should stick with what you started with. That's changed. So right now, the recommendation is it doesn't matter. And definitely Pfizer and Moderna are pretty interchangeable because it's the same technology. But the real change that came out was saying that it doesn't, there's no downside if you had Johnson & Johnson for one to have either Pfizer or Moderna for the other as initial versus booster. But actually there may be, and it's a maybe at this point, there may be benefit of mixing. Yeah, I just did it out of curiosity. I had Moderna as my initial series, and I got Johnson & Johnson for my booster. But that's not based on any science that's any better. But there is some thought, particularly with Omicron, that it may be a little beneficial, but they're still working on the science.
So you're just being your own kind of lab specimen by doing it this way, by getting the J&J after the Moderna.
So I'm not advocating people mix and match, but definitely you can. And for us at our Dulles Town Center location, we provide all of the formulations. When we do go on the road to try to bring vaccine closer to people, that typically we only go out with Pfizer, because they're approved for everyone from age 5 to 105. And that way it's easier to just go out with 2 different formulations, the children's formulation of Pfizer and the adult formulation, rather than bringing 5 different types of vials out with you. And in general, that's perfectly fine if people want to get their booster with Pfizer when they got their initial with Moderna. Now, for 16-year-olds, when they get their booster, it has to be Pfizer because that's the only one that's approved for people under age 18.
Gotcha. For boosters only, right? Not for initial.
And same with initial, that Moderna and Johnson & Johnson are for 18 and older only.
Okay, great. Great. I wasn't aware that they hadn't been approved yet. I guess, is that process in the works?
I think it's in the works. I guess in part it's on the onus of the companies to see whether it's worth their time to do research on those specific age populations and then provide that data to the FDA to get that authorization.
Got it. So for adults, the takeaway is there's no harm in mixing and matching, and it's better
Not
to
at
just
all.
get the booster if you can.
There may be a benefit, there may not be a benefit, but there's definitely no harm to mix and match.
Got it. Great. Thank you. Justin, next question.
Yes, our next one here is from Laura from Leesburg, who says, I wanted to know how or what the CDC is doing for those of us who can't get the vaccine due to health reasons. I would love to get vaccinated at this time, but know that it's not possible. Has Pfizer, Moderna, or the CDC focused on this issue?
So we do ask folks if they have medical conditions to talk to their healthcare provider and make a decision that's right for them. But that said, the only folks who can't take these products are people who have a history of an allergy to the product or a component in that product. Some healthcare providers may say because of this person's medical condition, that the risk of the vaccine may be greater than the benefit, but they are still can take it. There's a precaution for them, and I'll provide a link to folks on the CDC's guidance on this. But in general, they can take the vaccine. But that said, that's why we do all these other mitigation strategies. And so the mask wearing, testing, staying home when sick, having everyone else around that person be vaccinated are all critical to keep a person safe who truly cannot get vaccinated.
So it's just getting to herd immunity is the best thing we can do, is what you're saying with this, and check your local listings and talk to your doctor about whether it's really advisable.
Herd immunity is important, but specifically that small herd immunity, because we have that with other health conditions, like for pertussis or whooping cough. Why it's important for all the adults and older brothers and sisters to get vaccinated is because very young kids can't. And they're the ones that are most likely to get hospitalized if they get infected. So if a person can't be protected, we want to cocoon that person, get everyone around that person protected so that the virus can't make it to them.
Yeah, very good. Thank you.
That leads well into our next question, which is from Tom from Potomac Falls, who says the CDC website recommends that citizens get vaccinated, quote, unless a vaccination provider or your doctor tells you not to get it. So why would politicians insist that a person must get vaccinated no matter what? Would it not be more reasonable for politicians to recommend each individual seek advice from their physician?
Yes.
Well, as a politician, I would say absolutely. Yeah. Talk to your doctor before you make any decisions about whether to get the vaccine or not. For most people, it's perfectly safe and effective, but if it's not safe for you, then you should not take it. So that's something that you have to talk to your doctor about. So
yeah. So we always encourage folks, if they have any questions or any doubts, to talk to their healthcare provider. But that said, these have gone through the same process that all the other vaccines have gone through to be shown, at least for Pfizer now, which is completely approved to be safe and effective. But whether it's a flu shot or COVID shot or Tdap, if you have any questions or concerns, we always say talk to your doctor to make sure that this is right for you. But we don't want everyone to talk to their doctor before they choose to take the vaccine if they otherwise feel like, oh, I've researched it myself and it looks fine. I understand and appreciate the guidance from the Virginia Department of Health and CDC, and I'm comfortable with it for a number of reasons. One, a lot of people don't have access to a healthcare provider to ask that question. It would be great if everyone could call up their doctor and get an individual answer right away. This really is not much different at all as a vaccine than all the required vaccines kids go through, all of the vaccines we get routinely throughout our lifetime. And with that, we do encourage all patients to be active healthcare consumers. Talk to your doctor if you have questions. But if you don't have questions, these are safe and effective. In the United States, it's been provided hundreds of millions of times already. At our Dulles Town Center, we've been provided over 300,000 vaccinations to people in a very safe way. And we have good data on it now. So we understood that last December and January, it was new on the market. We have some folks who are early adopters and wanted to be first in line, and some wanted to wait and see approach. We now have a good year's worth of data showing that these are very safe, very effective. The side effect rate is very low from the vaccines. Really, the only question we don't have is what happens 5 years, 10 years, 20 years after you get vaccinated. But they do have the knowledge of other vaccines where we know that in large part, if you're going to have a problem with the vaccine, it happens in the first 30 to 60 days after vaccination. So we've seen what's come out with side effects from vaccines so far. But definitely, if someone is still on the fence, your doctor is the best person to ask. While understanding we're on Facebook Live, Facebook is the worst person to get advice from because typically it's wrong. But for the people that you trust in general in your life, those are the ones we say talk to them if you're on the fence about vaccination.
Thank you, Dr. Goodfriend, and thank you for that last part, because I was going to add that there's so much misinformation and disinformation on the internet. So if you are going to do your research there, please make sure that it doesn't just rely on your Facebook feed, because my uncle heard that this happened to this person once. Kind of stuff is not this anecdotal, non-verified stuff is not fact.
Yeah, and if people want to ask us, they can email the health department, whether you're a Loudoun resident or not. health@loudoun.gov. We're happy to point you to the information from creditable sources. Similarly, we've got an emergency COVID line, which we ask anyone 5 days a week to give us a call if you have a question, 703-737-8300.
If you have a family physician, who knows your condition and knows your history, then obviously that's the best place to start for sure.
Yeah, and folks should be able to see a link that from the CDC on precautions related to vaccination. But in general, for the typical 98% of folks out there, by far the vaccination is a safer way to go than not being vaccinated.
Thank you, and thank you for including that link in the chat.
We have a couple questions in the chat based on something you were just talking about, Dr. Goodfriend. Some of the long-term effects. Someone was concerned about different long-term effects that they're seeing or hearing about in terms of people with heart conditions, things like that. Can you speak to any potential long-term effects of the vaccines that we're seeing, and any concerns that people with certain conditions should take precautions about?
Well, one of the things that we had been seeing is in young males, where they would have some heart inflammation as a result of the vaccine, typically mild and self-limited. But it goes with specific types of vaccines. So there are recommendations for younger male age groups that they may want to take Johnson & Johnson versus an mRNA vaccine. But the main concern with long-term side effects we're seeing is not with the vaccine, but with the virus, what's called long COVID, because we know that the large majority of people who get COVID and don't need to get hospitalized or unfortunately pass from it will get over it in a week to 2 weeks. But there is a minority of folks who, even after the virus is cleared, just never get back to their normal self. Whether it's, people call it brain fog, muscle aches and pains, it affects different people different ways. But it is one of the potential long-term aspects of COVID that vaccination will prevent.
Yeah, and I know some people who lost their sense of taste and smell and still haven't really gotten it back, and they say that impacts the quality of their life more than you can imagine, not being able to taste their food and things like that. So yeah, long COVID is scary, and some of the weird impacts that people get from it are just still being discovered. So yeah, thanks. Justin, do you have more questions for us?
We do. We've got a few more here. This next one comes from Jonathan from Prince William, who asks, why is there a push for masks and vaccines when, even though they've been in place the last 2 years, they haven't stopped the spread as much as we hoped?
Yeah.
So I'm just going to say a couple of things about masks and all. We know that they work, and think about how bad it would have been had we not had masks in schools and things like that. So I'm also really glad that to hear that Governor-elect Youngkin is not going to impose a statewide mask ban. I think that's wise. I think that leaving it up to localities is smart. And so we'll see what the localities around here come up with. But I think that it's much better if you're not going to have a statewide mandate, which is not if you're not going to have a one size fits all approach in one end, you shouldn't have it on the other end. So I think that it's good that he's allowing that to the localities to make those decisions.
Yeah, and what we have seen is that mitigation strategies work very effectively, and one of the great ways that labs that we're seeing it is in the schools. We have almost a semester behind us in the schools. We have our public schools in Virginia that have been required to have indoor mask mandates. We have some of our private schools that may have lower vaccination rates and have more exceptions to mask use. And at least in Loudoun, where we're seeing not the first case coming into the school, but whether that first case becomes an outbreak or not within the schools, it's occurring a lot more in our private schools than in our public schools. And I think really, when you look at those root causes, are those mitigation steps in place? And as I said earlier, none of those mitigation steps by themselves are perfect. Each one will allow some people to get infected. So even if everyone's vaccinated in a classroom, you easily may have some people get infected. If everyone's wearing masks in the classroom, some people may get infected. So you put all those together, a good testing regimen, making it perfectly fine for kids to stay home if they're sick, so there's no incentive for a sick kid to come into school. Each of those mitigation steps have really made a difference. And I know, at least in Loudoun County, because I can speak for them, if you look at the public school dashboard for COVID cases, you really don't see that many people in quarantine compared to the number of people who are actively infected, because we're not seeing a lot of additional exposures in the classroom. And that's different from some of our private schools, where we've had some schools that have had to stop in-person education completely because of uncontrolled outbreaks during the season. I did post a link which shows a graph from the Virginia Department of Health on the number of cases by vaccination status. And while it varies week to week, it is a very significant difference between the likelihood of becoming infected if you're fully vaccinated versus not. The other thing that's very telling, and I'll try to get that link up to folks as well, is when we look at the number of cases by age group in kids, prior to vaccination, all the age groups essentially got infected at around the same rate. As soon as the 12 to 17-year-olds were able to get vaccinated, we saw their rate of infection go down dramatically. And the 5 to 11-year-olds became by far the dominant group of people who were getting infected. And that's because they were in the school, they were having a lot of contact with others, but weren't yet able to get the benefit of vaccine. So all the other mitigation strategies in the school were in place: mask use, distancing, staying home when sick. The only difference was they didn't have vaccine. And that's why we're really pushing to get that vaccine into 5 to 11-year-olds. We think that'll make one of the biggest differences over the summer. And I'll try to get that link up to folks as well. And for that, you could look at both Virginia overall and then drill down to individual counties to see that distinction.
Thank you, Dr. Goodfriend. That's very interesting to have data like that. Justin, do you have any more questions?
Thanks for sending along those links. We're getting those up on our Facebook and YouTube comment sections in real time. That's very helpful. We got this next question after the two of you are speaking about COVID disinformation. This is on our live chat. The question is, can you release a list for constituents of reputable online COVID-19 resources?
Well, we do recommend for each of our jurisdictions, they've got very good COVID pages that I'd recommend folks go to. And if you just type in the city or county name and COVID, very likely that'll be one of the first that will come up. And over time, I can speak for Loudoun. What they've tried to do is come up with good resources to send people to. In terms of providers, we think most providers out there are very expert in dealing with COVID. Now, there may be, as we talked about earlier, with long COVID, that is a new specialty that is coming out because it is very challenging. For those in Loudoun who are more familiar with Lyme disease and chronic Lyme, there's some similarity to that of after an infection goes away, the damage that's been done to the body is hard to get people back to their baseline. And so I think that is a growing area for folks because there isn't one approach that works for everybody. And our hope would be, because we do have a good community of healthcare providers used to dealing with people with long-term side effects of Lyme disease, that the hope would be that similar type of interventions will help with those with long COVID. But if someone has a specific resource they're looking for, definitely feel free to email us, health@loudoun.gov, call us 703-737-8300. You don't have to be a Loudoun resident, and we can help work with you to get that information.
I think it's a good place to start. I mean, you can look at the CDC website, but it is kind of dense and there's a lot going on there. I think you're much better off with your local health department, whether it be Fairfax, Prince William, Loudoun, or Lord Fairfax for our friends over the mountain. So, there are many different options, and they have good local information. And Dr. Goodfriend, that's interesting that you draw the analogy between the long COVID and the Lyme, because that's what I was thinking about too. I know that a lot of the symptoms and the ways that people feel and the fact that they're still having these impacts many months after the initial virus clears up is kind of reminds me a lot of Lyme disease. And obviously we have a lot of that here in Loudoun County and this region. So something that's very interesting to me. So hopefully we'll come through with some, we'll medical science will come up with some new treatments for that and it will help alleviate those symptoms and what people are going through. Justin, do we have any more questions?
Another one from the chat. This person asked for any information on vaccination rates between rural and suburban sections in the district and how they're both faring.
So I can tell you in Loudoun County and more broadly, rural populations are more of a challenge. So when we look at who's getting vaccinated and who is less likely to be vaccinated, to a large extent, some of those patterns hold with a lot of our services. Our most vulnerable populations are typically immigrants and low-income individuals, people who are less likely to have health insurance, to get information in English. Those tend to have lower rates of vaccination than the population in general. But what's new with COVID that we really haven't seen, at least I haven't seen before, is folks who are more rural, more white, who, not because of a barrier to care, but I think more in belief system of vaccination and other mitigation strategies, are choosing not to get vaccinated or choosing to wait longer. And that really is a challenge for us. And what we're seeing is, so for example, in Western Loudoun County, our vaccination rates are lower than in Eastern Loudoun County. And low to the point where it's now down to that level of our more vulnerable population. So if you're a Spanish-speaking immigrant in Loudoun County, your chance of being vaccinated is the same as being someone living in Hamilton, which is new and more challenging for us. So one of the things that we've been trying to do with outreach is to get a better understanding of that. We have a really good partnership with a pastor, Justin Ulrich, with Terra Forma Church, who was very helpful. We had a series of talks on WAVA radio talking about, from a Christian perspective, the importance of vaccination and not just keeping yourself protected, but protecting others. and also looking for other ways to try to communicate to individuals really just about the value of it, and regardless of who the messenger is. We understand that some folks don't like being told what to do, but regardless of how that message is coming across, trying to provide that information and having folks look to other sources of information to ask about vaccination. Because one of the things we do worry about is our private schools, because some folks similarly who are less likely to want to follow mitigation strategies are less likely to want to have their kids in the public school system. But also our churches, as we're going into Christmas season, that these may be areas where we may have significant outbreaks.
And Dr. Goodfriend, I would just correct you on one thing. When you said some people don't like being told what to do, I think most people don't like being told what to do. So this is obviously a choice for people, but it's something that is so important, and it's not just about you. It's about our whole community. It's about keeping everybody safe, not just you, but also your loved ones and your fellow community members. So yeah, but talk to your pastor, talk to your doctor, talk to trusted individuals about why you should or should not get the vaccine.
Yeah, and even if you choose at the end of the day to wait for vaccination, as I said, each of these layers of protection build on each other. So indoor mask usage as a voluntary basis is an important way of protecting not only yourself, but your loved ones. Getting tested is an important way of protecting yourself and your loved ones. No one's requiring you to do that, but it is a step that folks can take, again, if they're still a little hesitant about vaccine, to help prevent others from getting infected.
Yeah. And that's one of the reasons I think the masks and everything have been so effective in our school system, because kids are used to following rules. They're used to having uniform requirements and things like that, and just conducts of parts of codes of conduct when they're in school, and so it's not a big deal for them. Whereas for adults, it does tend to be a much bigger burden for many folks. So
and particularly in the beginning of the school year, there was a lot of question and concern of what type of barrier would that be for kids to have to wear masks all day? Will they be able to do it or not? Will they be able to learn in that environment? And well, I'm not an educator. In general, the feedback I get as a parent and as working with the Loudoun County Public School systems is they adapt very well and very easily. And getting breaks from masks is very important, and the schools have worked around that process. And as you had said, anything we can do to keep our kids in school, because we know the significant mental health impact of schools closing down. So how do we best protect them?
Yeah, kids are amazing because they're incredibly resilient and adaptable, which is good at that age. Fantastic. Good. Justin, do you have any more questions?
I think we've gotten through all of our pre-submitted and questions in the live chat.
Okay, wonderful. Good. Well, thank you so much, Dr. Goodfriend, for joining us this morning. I really appreciate your insights and everything that you're doing for our community. If you have any further questions, please take a look at my website or visit vaccinate.virginia.gov. Your local health department has lots and lots of resources, as Dr. Goodfriend said, and you can always reach our Sterling district office, which can help you, and they can help you with accessing vaccines or other questions that you may have. And that number is 703-234-3800, and I'll repeat it, 703-234-3800. Dr. Goodfriend, do you have any final thoughts or advice for people?
I just want to wish everyone a very happy Christmas and winter break, and enjoy the fact that we can do it in a much safer fashion this year.
Amen. I absolutely agree with you. Everybody have a very, very Merry Christmas and a very Happy New Year. Take care and stay safe.